You can't let COVID-19 divide us. Coronavirus infects all kinds of people. It doesn't discriminate. So why should you? When someone coughs or sneezes or shows signs of the virus, tell them to call 888-1-LOVE immediately. And remember, stay 6 feet away, but don't attack or disrespect them, because we're all in this thing together. Come on, Jamaica. Cut the hate and don't discriminate. Let us stand together and fight COVID-19 as one family, one nation.
COVID-19 is still here. Always wear your mask correctly while in public places, covering your nose and mouth at all times. Masks should never be worn over the head, under your chin, below your nose, or hanging from your ears. Recovery from COVID-19 can take up to 60 days or more. The mask or the ventilator? You choose. A message from the Ministry of Health and Wellness.
So much for joining us for the Ministry of Health and Wellness's COVID-19 conversation for good evening again, ladies and gentlemen, members of the media. Thank you so much for joining us for the Ministry of Health and Wellness's COVID-19 conversation for Thursday, June 17. The Minister of Health and Wellness, Dr. Honorable Christopher Tufton, is joined by the Permanent Secretary, Mr. Dunstan Bryan, the Chief Medical Officer of Jamaica, Dr. Jacqueline Biseso McKenzie, and the Director of Family Health Services at the Ministry of Health and Wellness, Dr. Melody Ennis. We'll begin this evening's conversation with the update from the Minister.
Thank you very much, Stephen. Good evening, ladies and gentlemen. Good evening, colleagues at the table and all who are looking on. Thank you again for joining us. Today we're going to give you the usual update on the state of COVID in our country and the progress that we're making. We are making progress, certainly in terms of controlling spread, and that's positive. Beyond that, we will also discuss the issues around vaccines, and from there on, we'll answer questions. So I'm going to move right into it and ask the Chief Medical Officer, Dr. Jacqueline Biseso McKenzie, to take us through the data, the numbers.
Hi, good evening, everyone. This is our update with data as of the 16th of June, 2021. Next slide. So we are now at 49,503 confirmed cases. We had 74 newly confirmed cases and 1,023 deaths recorded. The deaths bring us to a 2.1% case fatality rate. We have a daily positivity rate yesterday of 10%, and our 7-day average positivity rate is 7.3%. So this shows what is happening across the country. The top pictures give you cumulatively, that is what has been happening over time since the 10th of March, and the bottom figures give you what has been happening over the last 2 weeks in terms of the number of cases. Next slide. So when we look at the geographical spread of cases, we would have seen that the number of communities that have been affected with newly confirmed cases over the last 2 weeks have been decreasing consistently. We now have 243 communities of the 783 statin communities that have new positive cases over the last 2 weeks, and that is 31% of communities. If you look at the dial to the right of the screen, then you will see that that puts us in the amber range, and where we want to get is in the green zone, which is below 25% in terms of the number of communities that are affected. And just what has been happening over time, in March, when we were at our highest point in terms of the number of cases, we had over 80% of communities that had new confirmed cases over a 2-week period. And that has consistently decreased, and now we're at 31% of communities that are affected, still in the yellow zone, and where we want to get is in the green zone, less than 25% of communities affected. We look at the number of confirmed cases by the date of symptom onset and the hospital admissions by the date of admissions. In the blue on the graph, you will see that the number of confirmed cases have been decreasing over time. And you can also see in the pink line on the graph will be the number of admissions, and this number over the last couple of days have been a bit up and down. We're not seeing that steady decrease that we had seen in the weeks prior, and we're monitoring this closely because on some days we are high in terms of the number of admissions, and this is a trend that we're watching carefully to see if the number of admissions are going to be increasing or are going to be continuing on a downward trend. In terms of the number of deaths that have been occurring, if you look at the red line on the graph, you will see that the number of deaths have been decreasing since March of this year. We do still have a number of deaths that are under investigation, and those deaths that are under investigation, the date of death has been over the last couple of months and couple of weeks. So sometimes each week or day you will see that a large number of deaths are reported. It really is not a reflection of the deaths that are happening now, because the number of deaths that are happening now are slowly decreasing. But it is that we are completing the investigation of some of the cases over past weeks or months, and then those would have been classified as deaths due to COVID. When we look at our system of grading in terms of the bed occupancy and the disruption that it is to healthcare services, we want to get to a low level of bed occupancy, and that low level is below 150 beds being occupied by COVID-related cases, because at that level we would have very minimal disruption of hospital services in general. Next slide. If we look at the positivity rate, we will see that the positivity rate as well has been decreasing over time. The pink line gives you the 7-day average positivity rate, and the blue line gives you the 14-day average positivity rate. And this has been decreasing over time. In terms of, though, where do we want to go with the positivity rate? I want persons to recognize that even at a 10% positivity rate, we are at a high positivity rate. We have been as high as almost 40% positivity rate. However, where we need to get to is below 5% for us to feel comfortable, or a little more comfortable in terms of releasing any restrictions that there are. So while it is that some restrictions have been released, we would encourage persons to be very, very cautious, to limit their chance of exposure, because there is still a fairly high positivity rate and a high chance of exposure in country. And where we want to get is when you see that level running below 5%, 2%, that's a good idea that we're at a good place. And remember that last year, If you look in the middle of the graph, you will see that last year when we were approaching the summer season, we were in about a 2 to 3% positivity rate, and that still resulted in quite a large peak in the following August, September. So we don't want to be at a positivity rate of over 5% going into the summer period. So everybody really needs to still be very, very careful, observe all the precautions, and limit their risk of exposure. We go back to the bed occupancy levels with this chart, just again to show you that the green is where we want to be with a bed occupancy rate of less than 150. Now, over the last couple of days, as I've said, we have noted that there have been up and down figures in terms of the admissions. That reaffirms that there is still a high positivity rate in country, and there may be pockets of persons within communities. There may be communities that will have high levels of transmission based on the levels of activities that are happening, and this is going to cause intermittent spikes in the number of persons coming to hospital confirmed with COVID, and you will see the bed occupancy going up. Again, urge to persons to ensure that they adhere to precautions, because we do not want to go up back to a point where we have a higher level of bed occupancy and to start putting at risk the other services in the hospitals. In terms of our reproductive rate, we are seeing an improvement in that, and our reproductive rate has been decreasing consistently. We are now at a 0.6 reproductive rate. Let us look at the next slide. We have been calculating the reproductive rate based on both the confirmed cases and the admissions. When we look at admissions, we see a reproductive rate of about 1. We want to be less than 1, but as I said, those intermittent spikes over the last couple of days have been pushing us towards 1 and even a little bit over 1. When we look at the number of confirmed cases, though, overall we see that the reproductive rate is decreasing at 0.6. And again, just to mention, when we go back to prior to the summer period last year, we were having very low reproductive rates, and that's where we want to be going into this summer period. Next slide. Again, just to show the importance of the non-pharmaceutical interventions, and I just want to encourage persons that even though you may see general restrictions being released in the public, generally, everybody should have exercise their own personal responsibility to enforce some of these restrictions on themselves, on their families and persons around them, because we know that the non-pharmaceutical interventions work. And we know that the gathering restrictions have been most effective in reducing the spread. And so we encourage persons to still avoid gatherings, to avoid any kind of parties or anything that there is a greater risk of exposure. Curfews and special geographic restrictions have been very effective. Border closure at the time when it was in force was very effective. Physical distancing, very, very important that person maintain the physical distancing. Even when you are wearing mask, then you should still adhere to the physical distancing rules. Public transportation measures, again, not to go onto crowded transportation carriers, and to ensure that you're wearing your mask in these vehicles. Shielding of the elderly, or the elderly still remain our most vulnerable, along with the persons with chronic illnesses. And for these persons, as much as they can stay away from any crowded situation, they are to do so and to adhere to precautions. Working from home, of course, will decrease your risk of exposure. Not going to the barber or the salon if it is crowded, ensuring that you're wearing a mask in those areas. All of those are effective, have been proven effective in reducing the risk of exposure and transmission in our country. Let me skip this slide. Okay, so overall, just to look at the indicators, and I skipped out the slide on vaccination because Dr. Ennis is going to give us an update on the vaccination. But just to say, looking at the indicators overall, 31% of communities affected, going down, that is good. Our bed occupancy is going down, that is good. Our transmission level at 7.3% is going down, and our reproductive rate is decreasing. However, we need to be consistent with our measures. We cannot afford to let our guard down now. We're going into a danger period if we take the experience from last year, where we saw that during the summer period, there were various activities and events that would have led to increased exposure and increased transmission rates. So this is not the time to let go of your precautions. Now is the time to ensure that you adhere to these precautions to keep the indicators going down. Thank you, Minister.
Thank you very much, CMO. Now, we've been having these press briefings for well over a year, and since the first case on March 10th, 2020, we have seen, 15 months? 15 months of consistent narrative around how to manage and to control the spread of the COVID-19 virus. And I know that some people would think that we are like a stock record in terms of the reminders, the urges, the caution, the restrictions. But the truth is that we now have enough time to see what works and what works best. The truth is that restrictions, restricting people-to-people movement, is a very and the most effective method or approach to controlling the virus. But at the same time, very importantly, we have to recognize and be conscious of the practical realities around people-to-people restrictions. And one of the things that has emerged over the last year or 15 months is the fact that the virus and the measures around restrictions come with side effects on our society, on our economy. From the social or psychosocial perspective, we have seen impact on, mental health. So persons who have been restricted to stay home have been impacted by anxiety, depression, not being able to pursue your normal habits of being with friends, family, just loneliness generally. And there are mental health issues associated with that, which has affected a fair part of our population. Beyond that, there are the economic challenges, which we as a government certainly recognize, and we see it every day. We're out in the field. Those of us who are members of Parliament, the Honourable Prime Minister, who is very open about dialoguing with stakeholder groups and meets with them periodically and frequently. There are issues around jobs, people not being able to access certain economic opportunities because of curfew hours, and it does take its toll. And after 15 months, we are seeing and we have seen evidence of that. So from a public health perspective, we advise on the best practices based on the guidelines, based on the scientific research, based on the lessons not just from us but from the international community, from our multilateral partners and bilateral partners around how best to control the virus. But we also appreciate that it's not just a public health response, it really is how you balance the need to control with the other critical activities which combined makes up the society. And you would have seen over the last 15 months an attempt at that balance. We have never really shut down totally. Some countries have. And we have opened to allow for certain things, but pulled back whenever there are signs that the virus is spreading. It requires an all-of-society approach. It requires Jamaicans to recognize that they have a personal responsibility. And it requires us in public health to continue to remind the population of the importance of observing the protocols. And so we will sound like a stock record because we believe in what we're saying, and it is the right thing to say from a public health perspective. Some may argue that the decisions around opening up contradicts the public health response and the public health guidelines. But I would say to those who argue that way to recognize that there is a balance that has to be struck. And like any society, any economy, we operate with multiple activities that have to combine, create the normal operations of any environment. And so you'd have heard the Prime Minister announce a series of measures in recent times over the past week or so, relaxing some of the curfew hours to accommodate more movement, to facilitate activities that were previously restricted, and essentially to balance the challenges or the side effects of the restrictions over the extended period of the pandemic. He has also signaled his intentions to do further reviews in another week or so, particularly looking at certain sectors like the entertainment industry. And we have been involved, clearly, public health, in those conversations, as we have been in all the discussions around COVID and the decisions around measures. We still have to say that the best practices are to minimize interaction, wear your mask, sanitize, physical distance, because those are the best practices. And it is so important that as a population, while we adjust to facilitate and to address the side effects around social and economic considerations, that the underlying protocols around the public health best practices are also maintained. And I want to just commend those who have continued to work on the management of the protocols, the public health frontline team with other agencies that have given support, the constabulary and others, and the Jamaican people who have, for the most part, observed those announcements when they are made, which has resulted in the numbers coming down. And to say we still have a long way to go. There are still risks out there. So even with announcements around relaxation, we must also remember that we have to observe and continue to observe those critical protocols in order to protect ourselves, our families, and by extension, the general society. Vaccines represent a critical component of that, and we have been gradually inoculating our population. A lot of what we do is a function of the availability of the vaccines, and once we have it, then we take it and make it available. Then there is the issue of access to the population, and we have been working on a plan to improve the plan so that all Jamaicans who qualify will have access. And then, of course, the third is to overcome hesitancy by providing information to persons who are uncertain or who may not think it is necessary. Those challenges will remain, but the immediate challenge right now is availability. And the realities are that vaccines are not as available as we would like them to be. And it's not a Jamaica problem, it's a global challenge. We do believe, however, things will get better. But I'm going to ask Dr. Ennis now to just give an update on the situation as it relates to vaccines. Dr. Melody Ennis, Director of Family Health Services, and what we can expect going forward in terms of the program around vaccination. Dr. Ennis.
Thank you very much, Minister. Good evening, everyone. So the vaccination program continues, and to date we have vaccinated just over 220,000 persons. Now, we have to look at those who have received their first dose and those who have received the second. So we are just above 168,000, specifically at 168,758. That's the persons who would have received their first dose. Now, of this number, some 51,908 persons have received their second dose. Please be reminded that persons are only fully protected after they have received both doses, and of course, it's 14 days after the second dose. And even though you have received both doses and you are fully protected, the protocols remain in place. You must continue to wear your mask properly, covering the nose and mouth, physical distance, and of course, hand sanitize and hand wash. Next slide, please. As we look more closely at who we have been vaccinating since the 10th of March, we realize that we have only vaccinated just about 6.2% of our population. We do have a far way to go to get to herd immunity. However, we are quite grateful because in the most vulnerable group, persons over the age of 80 years, we have vaccinated some 20% of those persons. And just over 10% have also received their second dose. So we are getting closer to that number of persons in that vulnerable group. Persons within the age range of 70 to 79, they have received the majority of the vaccines, and they number just about 23% of persons vaccinated. 60 to 69, somewhere about 17%. So you will note that the majority of persons are indeed in keeping with our program to vaccinate the elderly, which are the persons mainly with the underlying conditions that have a worse outcome when they contract the COVID-19 illness. Next slide, please. Again, the Kingston and St. Andrew region is the area that have vaccinated the most persons, followed by St. Catherine, St. James, and then Manchester. When we look, next slide, please. When we look a little closer to what's happening within the parishes, if we just take a few examples, so for Kingston and St. Andrew, although they have vaccinated the lion's share of the population, they are still just at about 9, 10, 11, about 12% of persons being vaccinated, and only about 3.3% of the population of Kingston and St. Andrew that are completely vaccinated. Another area, we can go to the middle of the island and look at Manchester. So although Manchester is looking at just close to 10% of persons being vaccinated, really it's only 3.1% that would be fully vaccinated, and 5.9% getting their first dose. And as such, we are moving into trying to get our numbers up over this weekend, and we will be vaccinating persons in our blitz activities, which will span just about 9 of our parishes. We will be offering in St. James, Kingston and St. Andrew, St. Catherine, Clarendon, Manchester, Portland, St. Mary. Have I left some out? Those will be posted, and the sites will also be posted. Now, for persons who are to participate in our Blitz activity starting tomorrow and running until Sunday, all these persons will receive a text message or a telephone call, and they will be advised what center they are to go to, the time they are to arrive at the center. Please be reminded, everyone, that we need to take along the identification card, a national ID. If you don't have that, then of course you're going to walk with a letter from a Justice of the Peace. And if you are in any of the special groups, you are asked also to take along your work ID. We do hope that one of those identification cards will also have your TRN number present on it as well. For persons who will be participating in our Blitz activities, it is second dose focus only for Friday, Saturday, and Sunday, and you will receive your text message or your telephone call. I believe, Minister, I'm going to stop here and you can go ahead. Thank you.
Okay, thank you very much. So earlier this week, we launched the new software called ComCare, which is a collaboration between the Ministry of Health and Wellness, UNICEF, and supported by the private sector vaccine initiative group with the representative, Mr. Peter Melhedo. It's a very impressive program. It allows us to track the numbers in real time, those who have been vaccinated, and also to dissect the data to give us a sense as to where these persons are, their gender, age, and it therefore allows us much better planning and also verification of who actually has benefited from the vaccine program. I want to just, it certainly is going to make our job a lot easier in the field. I've seen it at work 2 Saturdays ago at the Blitz at the arena, and I want to just extend my appreciation to the team who have worked on this to ensure that we are more efficient as we move into a more aggressive, if you will, vaccine program in the months ahead. It will certainly aid that process. We have been advised by the Ministry of Foreign Affairs and Foreign Trade that Jamaica is set to benefit from an initial donation of some 25 million doses of COVID-19 vaccines that the United States government has earmarked for countries around the world. Jamaica is classified as part of the Latin America and the Caribbean region, where donations are anticipated to be distributed starting the end of this month, the end of June. We're now, today is the 17th, so hopefully over the next 2 weeks or so, or less. In the meantime, we're also anticipating another shipment through the COVAX facility, and our agency, the National Health Fund, continues to negotiate the purchase of vaccines and explore other potential sources. Unfortunately, we can't give any more specific information on time. We have to give a range because vaccines are still a scarce commodity globally based on what is happening in the world, based on those who have immediate access or first preference because of where production facilities are, because of the nationalities of the manufacturers, and so on. And we therefore have to manage the process. It's a difficult management because, in a sense, we can't demand, and there is no automatic availability. And as I said, we can't demand or based on need. We have a need, we want the vaccines, but we have to negotiate access based on what is available and the willingness of the manufacturers to make it available. As a reminder to everyone, however, a single-dose vaccine does not provide full protection. I think Dr. Ennis said that. So even after receiving the second dose, we must also continue to exercise caution because you can still transmit the virus even after the second dose. We're therefore urging all of us to remain vigilant and adhere to the infection prevention control measures, the wearing of masks, the sanitizing, the physical distancing, things that we all should know by now. As has been reported by Dr. Ennis, the ministry also continues to administer second doses for persons who are due. So on Wednesday, effective Wednesday, June 16, which was yesterday, 49,084 persons have received their second dose of the vaccine, COVID-19 AstraZeneca vaccine, and we are now at 217,842 doses as of the end of yesterday, which means that we are making progress. The Blitz operation last weekend, we were able to do 10,608 Jamaicans who are given second doses. We had 815 who received their first dose. And our second dose blitz operations will continue this weekend. The second dose blitz operation will happen in 9 parishes across 22 sites, starting on Saturday, June 19th, with some sites continuing until Tuesday, June 22nd. It is important to note that the blitz operations this weekend will administer second dose to persons who are 50 years and older and who are obviously due their second dose. In other words, we have to focus on the most vulnerable. And the most vulnerable by age will be the 50 and over. And the second dose has to be the priority based on availability. And so we have to give to those who require, based on their dates, that second dose. And based on age, representing the most vulnerable. Contact will be made to schedule second dose appointments, as said earlier, for all persons who are due their second dose. The challenge we have is availability of vaccines. And we did say some time ago that during the course of June, maybe over into July, we hope not into July, but possibly over into July, we would have some challenges as it relates to the availability of vaccines. And so we're going to have to be more discriminatory or selective, to use a better term, in who we give access to until supply frees up a little more. As said, we anticipate an allocation out of the US based on the announcements and the discussions that are taking place within the next 2 weeks. We have ordered and paid for Johnson & Johnson starting in August, 1.9 million doses, not receiving all at once, but over several months, but starting in August. That is still on track, and we do expect to get additional supplies in July from the COVAX facility. But we are now at a stage in the administration of vaccines when supplies are tightening up. And I want to advise the public that it will mean that we have to prioritize in terms of who gets access at this particular point in time, and certainly over the next few weeks. I believe I'm echoing the sentiment of all around the table. So what it means is that in the next 2 weeks, we're going to have to tell some persons, no, you cannot get the vaccine, whether first dose, and perhaps in some instances, a second dose if you're due and you are below the age of 50. Because we know that some persons are due, if they calculate based on the 8 weeks calculation. I want to be very clear, so let me spend a little time on it, and I crave your indulgence and patience. When we had embarked on this program, the protocol guidelines that were announced around AstraZeneca was that the time between your first and your second dose would be between 8 and 12 weeks. Now, I believe in some health districts, persons were told 10 weeks, and I'm going to probably ask Dr. Ennis to comment on this, but let me try to explain it, and then you come in as the clinician, since I'm not a medical doctor. It is important that the population, or those who are below 50, who have had a first dose, who are now looking to get a second dose, but are within the 10 to 12 week period right? The 2 months to 3 month period, 8 to 12 week period, recognize that if you are at week 8 or week 9 or week 10, you still have some time to get that second dose. So if you pass the 8, 9, 10 weeks, you may believe that you're overdue, but you are not overdue because you have between 8 weeks and 12 weeks. The reason I'm stressing that is because, as I said before, we are now forced to prioritize the most vulnerable, 50 years and over, and those who are in that category, in that cohort, who are due to get their second dose. And so if over the next 2 weeks we run low on vaccines, we're going to have to possibly say to a 35-year-old, 39-year-old, while you are in week 10 or 9 or even 11, you may not be able to get your second dose. Hold until we get in touch with you and indicate to you where to go to get that second dose. So I say this with emphasis because some persons may feel disappointed going into the weekend and maybe into the next week because they feel they should get their second dose. You are not in any danger once we are within that period of time while we sort out getting additional supplies. Dr. Ennis, I think it's important for you to just explain the 8 to 12 weeks so that persons are very clear that clinically it is still sound clinical protocol. Yourself or CMO.
Thank you very much, Minister. I think I may soon be able to give you your medical degree, sir. You have done a pretty good job explaining. So, ladies and gentlemen, please note that after you get the first dose of the vaccine, the germ-fighting tools, they decline over time. But when you get to about 120 days in your 3-month period, you still are protected just by about 30%. And the recommendation, therefore, is between your 8th and 12th week for getting the second dose. Now, also recommended is if you have missed that 12-week mark, you are really to get the vaccine as soon as possible after. We're not going to be restarting the schedule. It will just continue. Now, when we gave dates for second dose, when we started in March, the majority of persons would have received their second dose for week 8, and all of those persons would have been vaccinated in the Blitz past. So we are now, for this week, actually vaccinating persons who would have received 10 weeks as their date for the second dose. So those persons we are deferring for another week or 2 are still within that 12-week period. And that is very important. So you are protected from your first dose because you're still within that period. And the recommendation from the experts continue to say that once you have passed that 12 weeks, then you get your vaccine as soon as possible. As Minister indicated, we are anticipating doses early in July, late in June, so that persons may not fall outside of the 12-week mark. But for those persons this week, you will be at week 10, so deferred persons have nothing to worry about. Thank you, Minister.
Okay, so that hopefully would have explained the position going into the weekend and in the next week or so. But I just want to add to that also that for first dosers, persons who are seeking to get their first dose, we will have to delay for the time being administering that first dose until we get additional supplies in order to give priority to the vulnerable age cohort who are due their second dose. And I think that is also important to note. Beyond that, I think we are making progress in terms of managing the spread of the virus with the numbers going down, hospitalization, positivity rate, and the administration of vaccines to the extent that we have is going smoothly. And we certainly look forward to this weekend when we will continue our blitz operations, as said earlier, in 9 parishes and 22 sites from Saturday, June 19th to Tuesday, June 22nd. And persons will be contacted to indicate where they should go. And we want to discourage those who are not contacted from going out, because we will have to maintain stricter guidelines around who gets vaccines that are available for the time being. Thank you very much, and I hand back to Stephen for any questions.
Thank you very much, Minister. I was going to invite our media colleagues on the Zoom to use the raised hand feature if they have questions for the panel. We're going to begin with Emma Lewis.
I don't know what your thoughts are on this, but I get a sense that some, even in the vulnerable age groups, that there is a certain amount of hesitancy there in your key age groups. And I wondered how you feel about that and what can be done to tackle it, if it is a problem, but I'm sensing that it might be. The other thing is about the deaths. Why does it take so long to investigate some deaths? This might seem like a silly question, but I've noticed that you have a backlog. Apparently, a lot of deaths in St. James are just coming through now. And just a little thing that struck me when I was looking at your graphs, what's happening in Westmoreland with vaccinations? I see that doesn't seem to have got off the ground yet. Or that's what I noticed from the graphs. Maybe I'm wrong. Thank you.
Issue, and then I'll allow the clinicians, they can expand on that and then more specifically comment on the second question. I think it's a bit early to conclude on the extent of hesitancy in the population, because I think there are other challenges that we would want to address to ensure that we have a better picture. There's no doubt that there's some hesitancy. We've done some polls to look at some of the reasons behind a limited take-up among certain categories. So, issues around vaccine brands, for example. The numbers are suggesting, based on what our polls that we have done in assessing the space, that Jamaicans have a particular affinity to certain brands and are more confident in taking one brand over another. I won't comment on what those are, but it gives us an indication in terms of our planning. Beyond that, too, is the issue of access. So hesitancy has to be measured in the context of access. Until you have access, you can't claim that hesitancy is the big elephant in the room, so to speak. And one of the things that we will have to plan for as we get greater supplies is how we reach persons within the communities across the length and breadth of Jamaica. Now, I think we have done a fairly good job to date. But the truth is, if we had a lot more vaccines, we probably would need to do more in terms of reaching those hard-to-reach communities and populations, persons who live in the very deep rural parts, persons who don't go out very much because of age or other restrictions. And so the dialogue with the churches, with the community-based organizations, with the elected representatives is important, and that has started, and we have benefited from some of that to date, including that first blitz when we brought out 83,000 in 4 days. The communities were mobilized. But there are some other things that we're developing that I think will give greater access. So mobile units, for example, sending them out into a community. The locations that we choose and the partnerships that we forge, doing it in a church hall in a community, for example, and or some other location, engaging the private doctors. So those are things that I think will become more a need as we get more supplies, certainly as we go closer to August. And then we will have a better sense as to the extent of vaccine hesitancy, which is, of course, that persons don't want to take the vaccine. I think we have to overcome the access issue first. The other question about the investigations of deaths, I don't know if CMO or who wants to take that on.
In terms of the investigations of deaths, we really regret that some of the cases are taking so long to come to an end of the investigation. And it really is dependent on how soon we get the information from the hospitals. In some cases, postmortems, different things will contribute to the delay. And, we have been working with the parishes and with the hospitals to try to get the information in as soon as possible so that we can classify the deaths. And we are working steadily to try to get rid of that backlog of deaths that need to be classified.
Is there a particular issue with Westmoreland?
Ms. Lewis, there really is no particular issue with Westmoreland. They started a little bit later than the other parishes in the western region, and therefore their second dose would really not be ready to be administered until next week and the following week, actually. So Westmoreland, we have to give them some time until the end of June before we make any determination as to their numbers. But they are pretty much catching up with the rest of the parishes in the West.
Thank you very much. We're going to go to Janet Silvera from the Gleaner.
Thank you. My questions are, how many persons under 50 with their first dose will be affected, you believe? If you have an estimate, it would help. How do you know that they won't go over the 12 weeks that they're due to be vaccinated? And do we know how many vaccines we're getting from the United States, 25 million that they've promised to the rest of the region? How many people are actually dying on a daily basis? Because if this is still supposition on my part, then, because we're really not sure how many people are dying on a daily basis. If we're just getting the information on persons that have died weeks ago, what is the actual number of persons dying on a daily basis? Thank you.
Okay, thank you. Janet, you've asked 4 questions. How many persons over 50 first dose? And how do we know that they're going for the 12 weeks? All right, so you have the data on the over 50 first doses? Under 50, sorry. You have any idea of
Under 50?
Yes.
About 35,000. For the persons under 50 who may be affected, it would be about 30 or 35,000 persons. I don't have the exact figure, but it's in that range.
I think it's just for clarity. I think it's important to determine what affected means. So it's not that they are losing their opportunity to get their second dose, which is why I took some time to explain the 8 to 12 weeks. It is that they may not be able to get the second dose on the date of the 8th week or 10th, 9th or 10th or 11th. They have another 4 weeks to go. So what it is a delay as opposed to them losing the effectiveness of the vaccine. The issue of the certainty of the 12-week period. We are relatively certain, based on the discussions that are taking place. I spoke to the Minister of Foreign Affairs and Foreign Trade today, and we communicate frequently because her office is dealing with a lot of the diplomatic conversations around the U.S. in this instance, as well as the National Health Fund, who is also pursuing other channels. And in fact, today, the issue of the number of vaccines that we will receive is still uncertain. You know, it's not comforting, I know, to the population, nor to public health, to give so many sort of uncertain responses that involves uncertainties. But we're being transparent. We haven't been told it's 100 or 200. We've just been told 25 million, and the Caribbean will get an allocation, or Latin America and the Caribbean, and it will be proportionally allocated. What I will say is that given that Jamaica ranks one of the most populous countries in the region, if you were to go by the percentage of the population vaccinated and the overall population, then we would certainly be one of those countries in the region, meaning the Caribbean region, to receive a fairly large amount. So we are hopeful. But as soon as I get that information, I promise you, the country, we will make it available. But the discussions are taking place. How many actually die daily? I'll leave that to the clinicians, Dr. Ennis or CMO.
Okay, we actually show a slide. I don't know if there's a slide that shows the number of deaths that actually gives you the date of the death by occurrence of the death. So you can, on the graph, what you can actually see is a trend. You really would have to really go on the numbers themselves. So I can give you for the, let me see if we have it. No, go back, go towards the beginning. No, it's this one. Right. Okay. So this gives you the number of deaths by week of occurrence, and you can see the numbers are there on the side. Not sure if you're seeing, Janet, but it will gives you an idea of the number of deaths by the week. So you would see for the last couple of weeks, week 19 to week 21. And I said that you have to, that downward trend that you see at the end of the curve there, can't rely on that so much because some of the deaths would have been still investigated. So we would have to take maybe at about week 21, and we can see that for that period, week 19 to week 21, we will be seeing an average of about 20 deaths per week. So that gives you an idea of how many deaths per day. So maybe an average of about 3 deaths per day. That's an average. So that's where we are now. Still high in any deaths is a lot, and 3 deaths per day is still a lot. But we are coming from pretty high numbers, where for the peak week, which was in the 11th week of the year, we had about 74 deaths for that week.
Thank you very much, CMO. I'm just going to allow for a quick follow-up from Janet.
Thank you. Thank you very much. It's really a new question. It's about the field hospitals. We haven't used them up, have we? Not much, have we? I wanted to find out about that. Would you say that we have not really had the need to use up those field hospitals?
Well, you are now talking to us when we are at an average of about 200 to 300 beds being occupied per day. So the use has come down quite a bit. But certainly at the time, March, April, we were at very high occupancies of those field hospitals. And certainly for the hospital at Spanish Town, the field hospital at Spanish Town, that was fully utilized at that time. But now the occupancy is down a bit. Spanish Town does still face the challenge of quite a bit of admissions to their hospital. In Falmouth and in St. Joseph's, those two at the peak were quite high. I don't think they touched 100% consistently for any period of time at that time, but they have been consistently coming down as well. But all 3 of those additional spaces that we put in have been utilized and have really been serving their purpose.
Thank you very much, CMO. I want to go to Zara Burton from 18 Degrees North.
Good evening, everybody. I wanted to ask a follow-up to Janet's question, or maybe it was Emma's question, about investigations of deaths. Is it that for the COVID-19 deaths, the ones that are under investigation are autopsied, those bodies, versus the ones that are definitively COVID-19, and it's doctors who just based on their own analysis have determined that those died from COVID-19? So that's one question. And the second question is related to an article I saw, Gleaner, I think it was several months ago, back in March maybe, or earlier, about negotiations with the Indian government. It was something to do with experimental vaccines that the Indian government wanted us in Jamaica to run experiments for their vaccines. I just want to know, did we here in Jamaica ever have any discussions with the Indian government or any other kind of manufacturer of vaccines to run experiments here in Jamaica on vaccines, and what was the response that we gave to those manufacturers?
Thank you very much, Ms. Burton. I will start with the last question. So last year, when clinical trials started in the various countries, countries were approached to have persons participate in clinical trials 1, 2, and 3. Now, persons from the Caribbean did not so participate. So when you look at the documentation from the manufacturers, for example, AstraZeneca, they would have conducted their trials not only in the UK, but also in Brazil. And if you go through all of the guidelines, you will see in detail where persons participated in the clinical trials. And to the best of my knowledge, the Caribbean countries have not participated, and Jamaica indeed did not take part in any of the clinical trials that took place last year. The phases 1, 2, and 3. There are some manufacturers that continue to be in their phase 3 trials. We're all interested in the Cuban vaccine, for example, and Cuba is doing their own trial within country of those persons. So it's really a no. We have not participated in any of the clinical trials for COVID-19 vaccines so far.
With regards to the deaths, I can't say specifically because there are a lot of situations that would surround the investigation on the deaths. So many of them we are waiting on the case reports and the investigations that were done at the local level. So I can't say specifically how many are waiting on postmortem reports, if postmortems were actually done, versus how many are just waiting on case files to come in. I can't say specifically how many, but there's a variety of combinations of things that we're waiting on. And we are in constant communication with the parishes to try to get that information in so that we can complete the review.
Thank you very much, CMO. Our final question comes from Debbie Ann Wright from the RJ Aglina Communications Group.
Hi, good evening. Just wanted a clarification as it relates to vaccination. Is it that the health ministry has now halted giving first doses? Also wanted to know how concerned is the health ministry at this time about the Delta variant?
I'll allow the clinicians to address the issue of the Delta variant, which is a concern, a genuine concern. What we have said is that for this weekend, we are focusing on 50 and over, second dose. And we are saying to others who do not fall in that category to hold until further notice, because we are giving priority to a priority group. And so that is the position for this weekend, going into the Blitz. 50 and over, second dose. All others hold until further notice. And we also gave the context of the further notice, the discussions taking place around additional supplies and the expectations that we should get within the coming weeks, and also that persons are not in any jeopardy if they pass their 8th week, 9th week, 10th week, 11th week, because the protocol, the science of the vaccine, the AstraZeneca vaccine, allows for an 8 to 12 week application of the second dose, which would maintain the efficacy of the particular vaccine. On the issue of the other question.
Right. So, like every other country, we are pretty much concerned about variants. We would have seen that in the UK, last week it was reported that 90% of their newly confirmed cases were the Delta variant. I see this week the reports that I'm seeing say 60%. But certainly in the U.S., last week it was 6% of new confirmed cases were the Delta variant, and this week it's 10%. So there's definitely an increase in the spread of this variant. This variant has been found to be 40% more transmissible in some. That is what is being preliminarily reported in from coming out of the UK. And also there is a report as well that it is 2.61 times more likely to result in a severe illness and hospitalization. So we are concerned about this, and many persons have asked about our quarantine measures and the maintenance of the quarantine measures when persons come into country. And this is one of the things that is important for Jamaicans to understand. While you see quarantine measures being released in other places, it's important, many countries still maintain their quarantine measures, and it is because of the risk of the spread of these variants that even vaccinated persons can bring into country. That's why we would want the quarantine to be in place, and also to encourage Jamaicans to be careful when they travel abroad, to ensure that even though they may go into jurisdictions that do not require the maintenance of the precautions that we are advocating adherence to, that they do maintain those precautions, because they may bring back into country a variant that is naive to the population, and of course that means that it will spread very, very quickly within the population. But just also to say that with the vast number of persons that in country that are not vaccinated, we remain at risk from all the strains of the COVID-19, and so we are still at risk of exposure, but the variants do present an additional risk.
Thank you very much, Simo. I think we have a follow-up from Debbie Ann.
Yes, I just wanted to be clear about the instructions for second doses, whether it's this week that, are you starting this weekend that you won't be accepting persons who are below 50 years old for the second dose? I just wondered, based on something that Dr. Tufton just said, because I didn't get the impression that it was starting this weekend. So what about persons who have been notified already to come for their second dose this weekend?
So it will begin Friday, Saturday, Sunday. That's the 18th, 19th, and 20th. For all those 3 days, it's persons over the age of 50 for their second dose at the sites that will be announced. Now, persons who have already received a text message, I'm sure you would have also got a second message to say to please disregard that message, and your message for Friday, Saturday, Sunday will be out today, tomorrow, and well, today and tomorrow, tonight into tomorrow for Saturday and Sunday persons.
Thank you very much. So, Minister, I'm going to hand back to you now for your closing remarks.
Thank you very much, Stephen, and thanks to the team. Ladies and gentlemen, we continue to monitor, manage, and respond to the COVID virus, the COVID threat. We are seeing fairly significant improvements in controlling the second wave that we have had to encounter, with numbers going down, hospitalization, positivity, reproductive rates, which is all good, and it suggests that the measures have worked and the people have complied substantially. We, however, do appreciate and recognize the side effects, I classify them as, from the restrictions going on for such a long time, the social, the economic, and other side effects. And in our attempt as a government, the Prime Minister speaks to it a lot, to balance lives, livelihoods, and the general functioning of the society. We've seen some relaxation of measures, curfew measures, with the intention signaled by the Prime Minister for some further relaxations in the week to come. It's important, though, that from a public health perspective, that we continue to drive the message that precautions are necessary. We're still in the threat zone. The virus is still out there. Someone asked about variant strain, and yes, they are there, and we will be exposed given the movement of people across borders. And so it's still very, very important that while we adjust to address the side effects of restrictions, we also recognize the importance of taking responsibility for ourselves, for our community, and by extension for our country, because we can go back into a surge. And indeed, we do expect that we will have to face increases in spread associated with relaxation. And we have to advise that, warn against it, and try to discourage or minimize that spread that may occur or is likely to occur in the months ahead. In the meantime, the vaccination program is hampered by availability of vaccines. Again, not unique to us, but we have maintained the need to apply vaccines that are safe, and those vaccines are more challenging to get because of supply issues. We've seen where manufacturers have had to dump vaccines. 60 million, I believe, is the largest number I've heard from one particular manufacturer. So there are all sorts of reasons why availability is a challenge, including challenges with production, including hoarding. But I think things are getting better in that the larger markets, the US, our closest neighbor and ally from the developed world, are now signaling and getting closer to releasing vaccines to parts of the world, including the Caribbean and Jamaica. And those discussions are very encouraging up to today, based on what I've heard. And we do anticipate that we will see the benefits of that over the next few weeks. In the meantime, our best defense is to maintain the critical protocols, and for those who are most vulnerable, to take up the opportunity to get the vaccines that are available during the course of this weekend and the week ahead. Let's continue to work together. I believe we are doing well under the circumstances, and I believe if we continue to keep focus, we can in fact achieve the balance, while at the same time keeping the COVID-19 virus and the threat that it represents at bay. Thank you very much. Have a good evening.
Healthcare workers are working very hard to ensure lives are saved and people recover quickly from COVID-19. But their work is becoming harder because you're not wearing your mask, washing your hands with soap and water, or using hand sanitizer, and you are not maintaining physical distance. Let's limit the need for hospital beds and ventilators. Do the right thing. Cover your nose and mouth with a mask. Practice good hand hygiene and maintain a physical distance of 6 feet between you and others. COVID-19 is not over. Protect yourself while protecting others. A message from the Ministry of Health and Wellness.
I am Paula Llewellyn in Queen's Counsel, the Director of Public Prosecutions for Jamaica. We are in an era which focuses on all things technological. As such, material produced by all sorts of devices, including computers and phones, is increasingly becoming a central feature of criminal investigations. Good prosecutions are based on the fruits of good investigations. It is therefore